Have you ever thought that in just a few short seconds, everything familiar around you could collapse completely? Imagine a normal morning. You are sitting with your children and grandchildren, drinking tea, laughing, and talking as usual. Suddenly, your face droops, your arm can no longer lift, and your words stumble out in a way no one can understand. What is happening to you at that moment? The answer is that a stroke has silently struck. A stroke is a silent thief. It gives no warning. It does not wait for you to prepare, and sometimes just a brief delay can take away your ability to walk, speak, see, or even your life. Why is this illness so frightening, especially for those over 60? Because the brain, the control center of everything we do, when damaged, can bring down all the body's essential functions with it. So how can we avoid being caught off guard when it happens? Did you know that many studies have shown that if you recognize the early warning signs and call emergency services immediately, the chance of recovery can multiply many times over? Yet tragically, most patients ignore the first signs, thinking they are just fatigue or the normal effects of aging. Could it be that we simply don't truly understand these signs? And if it takes only a few seconds to save a life, why do so many people miss that precious opportunity? Before continuing, let me ask you something. If this information is truly helpful, are you willing to hit the subscribe button so you always receive tips on healthy aging? Try typing 1 in the comments if you believe this topic is important, or 0 if you think you don't need it yet. I believe that just one keystroke could help yourself and your loved ones avoid an unimaginable tragedy. So what symptoms are the red flags signaling that a stroke is knocking at the door? The very first symptom will startle you because it often appears right on the face or arm you use every single day. Can you guess what it is?
The first symptom. Have you ever felt that suddenly one side of your face no longer obeys, your arm drops, or your legs wobble as if drained of strength? If that happens abruptly, it could be the very first sign of a stroke. Why would a body that seems healthy suddenly stiffen and lose control like that? I will never forget the case of Mary, a 67-year-old woman in Florida. One morning, while she was on a FaceTime call with her daughter, half of her face suddenly sagged, her voice became distorted, and her right hand could no longer hold the phone. Her daughter panicked and called emergency services right away. Thanks to that, Mary was rushed to the hospital in time. If, at that moment, she had simply thought, "I'm just tired," and decided to lie down, what might have happened? She might have lost her ability to walk forever. Do you see how just a few minutes of delay can change an entire life? So why does a stroke cause numbness or weakness in the face, arms, or legs? Think of the brain as a control center, with each area responsible for a different part of the body. When the blood vessels supplying the movement or sensory regions are blocked, signals can no longer be transmitted. The result is like a car losing power. The wheels stop turning, the lights go dark. Do you see how just one small power outage in the brain can completely paralyze an arm or a face? One fascinating fact is that the left side of the brain controls the right side of the body, and vice versa. This means that if the motor area on the left side is damaged, you will notice weakness in the right arm or leg. And usually this phenomenon appears only on one side, not both. So if you or a loved one suddenly cannot lift one arm, or if you smile and your mouth pulls sharply to one side, would you dare to ignore it? The advice here is very clear. If there are sudden signs of numbness or weakness, never wait for them to go away on their own. Call emergency services immediately, because with every passing minute, millions of neurons in the brain are dying. The question is, how much of your chance of recovery do you want to keep? That is only the first warning sign. But do you know there is another common symptom, One that can rob you of the ability to speak with your very own children and grandchildren? Are you curious to know what it is? The second symptom. Have you ever tried calling out a loved one's name, but your mouth could not form clear words? Or has someone spoken to you and all you heard was a jumbled string of sounds you couldn't make sense of? If that situation happens suddenly, can you be sure it isn't a stroke knocking at the door? Why does stroke cause us to lose the ability to speak or understand? It is because the brain contains special language centers. The Broca's area in the frontal lobe allows us to speak fluently, while the Wernicke's area in the temporal parietal region helps us understand others. When the middle cerebral artery is blocked, blood can no longer nourish these areas, and language suddenly breaks apart. Can you imagine the feeling of wanting to say, "I'm fine," but only meaningless sounds come out? Or when someone asks, "Are you in pain?" and you cannot understand their words? The advice is very simple. If you or a loved one suddenly starts speaking haltingly, stuttering, or cannot understand speech despite being fully conscious, do not wait to see if it passes. Treat it as an emergency and call emergency services right away. Because every minute of delay can turn a healthy person into someone who may never speak again. Would you risk losing the ability to converse with your own grandchildren just because of a few minutes of hesitation? And remember, loss of speech is not the only symptom. There is another sign that is even easier to overlook: the sudden loss of vision in one or both eyes. Can you imagine the feeling of seeing clearly one moment and then watching everything go dark the next?
The third symptom. Can you imagine that in just a single moment, everything before your eyes suddenly goes dark? Every image disappearing as if someone had switched off the light? What could be more frightening than when the eyes, the windows of life, suddenly stop working? Would you dismiss it as simple fatigue or recognize it as a dangerous sign of stroke? So why does a stroke cause us to lose vision? Think of the brain as a giant screen, while the eyes are just cameras feeding images into it. If the screen is broken, no matter how good the camera is, you still won't see anything. The occipital lobe at the back of the brain is that screen. When the posterior cerebral artery, the vessel that supplies this area, becomes blocked, visual signals can no longer be processed and sight suddenly disappears. In particular, damage to the left side of the brain often causes loss of vision on the right side of both eyes, and vice versa. Isn't it paradoxical that the eyes remain clear, yet the brain fails to display the images? The important thing to remember is this: if you or a loved one suddenly lose part of your vision, do not assume it is just eye strain or ordinary dizziness. Every minute of delay permanently takes away a piece of sight. Do you want to wake up each morning unable to clearly see the faces of your children and grandchildren? And remember, stroke does not only steal your ability to speak or see, it can also leave you staggering, unable to stand steadily, robbing you completely of your sense of balance. Are you curious why someone walking firmly just moments before can suddenly collapse as if the ground were shaking beneath their feet? The fourth symptom. Have you ever been walking down a familiar street when suddenly your legs no longer obey, your body staggers as if you were drunk, and everything around you spins out of control? If that happens without warning, would you assume it was just a slight drop in blood pressure, or recognize it as a clear alarm bell of a stroke? So why does stroke cause loss of balance? The cerebellum, located at the back and underside of the brain, is the coordinator of movement. If the brain is the conductor of the orchestra, the cerebellum is the rhythm keeper, ensuring every step and movement is smooth and harmonious. When this area is deprived of blood due to a blocked artery, control signals become chaotic, leaving you staggering, clumsy, and unable to coordinate.
Can you imagine a dancer moving gracefully one moment, only to collapse the next because the music suddenly lost its rhythm? The advice is crystal clear. If you or a loved one suddenly lose balance, experience severe dizziness, cannot stand steady, or cannot coordinate movements, treat it as an emergency. Don't blame age or the weather, because even a single minute of hesitation can rob you of your ability to walk forever. Are you willing to let one moment of delay take away your independence for life? And don't forget, stroke doesn't only make you stagger or blur your vision. Sometimes it strikes with an even more terrifying signal, a sudden, severe headache with no obvious cause. Are you curious why such a headache might point to a stroke rather than just an ordinary migraine?
The fifth symptom. Have you ever experienced a headache so intense it felt like someone was pounding a hammer inside your skull? And the most terrifying part? It came completely out of nowhere, without the slightest warning. If such a headache hit you suddenly, would you dare dismiss it as simple fatigue or everyday stress? I once heard the story of Susan, a 69-year-old woman in Florida. One afternoon, as she was preparing dinner, a blinding, excruciating pain exploded in her head. She collapsed, unable to stand. Her family quickly called emergency services, and doctors later revealed she had suffered a hemorrhagic stroke. A blood vessel in her brain had ruptured, spilling blood into the brain tissue. Do you see how just a single headache can shatter an otherwise peaceful life? So why does stroke trigger such brutal headaches? Imagine the skull as a sealed room and the person as living inside it. When a blood vessel ruptures, blood leaks into space with nowhere to escape. The pressure inside this room skyrockets, squeezing the brain. That is why the headache comes on so violently and abnormally, completely different from ordinary headaches. Can you recognize the difference between a stress-related headache and the sudden lightning strike headache of a stroke? The most important advice is this. If you or a loved one suddenly experiences a severe, sudden headache with no clear cause, treat it as an absolute emergency. Do not try to lie down and rest, and do not reach for painkillers, because with every passing minute, the risk of death or permanent disability is rising. Would you let a simple pain pill deceive you and cost you the chance to survive? By now, you already know the 5 most common warning signs of stroke: sudden numbness or weakness in the face, arms, or legs, difficulty speaking or understanding others, sudden loss of vision, loss of balance or dizziness, and an unusual severe headache. But the crucial question is, what should we do if these symptoms appear? And is there a simple way to remember them all in just a few seconds? So, if one day you or your loved one suddenly experiences these warning signs, what will you do? Will you sit and wait for them to disappear on their own, or will you act immediately to fight for life? Neurologists around the world have created an incredibly simple rule, one you can remember in just seconds. It is the word fast. But fast here is not only about speed, it is also the 4 golden signs of stroke recognition. Are you curious what FAST stands for? F is for face. Ask the person to smile. If one side of the mouth droops, it's a dangerous sign. A is for arm. Ask the person to raise both arms. If one side cannot be lifted, be on alert. S is for speech. If the words come out slurred, broken, or unclear, it's a red flag. And finally, T is for time. This is the moment you cannot delay. Call 911 immediately. Do you see how just 4 short letters can put the power of survival in your hands? But beyond recognition, what else can we do to prevent stroke? The answer lies in the smallest habits. Keep your blood pressure under control, eat a healthy diet, exercise gently, get enough sleep, and most importantly, go for regular checkups. Do you realize that with just a few small changes each day, you could prevent up to 80% of strokes and heart attacks? So, After learning how to recognize and prevent stroke, the biggest question for you is this: how can we transform the fear of stroke into a message of hope so that every single day becomes more meaningful? We have just walked together through the 5 most common warning signs of stroke: sudden numbness or weakness in the face, arms, or legs, difficulty speaking or understanding others, sudden loss of vision, loss of balance or dizziness, and an unusual severe headache. You might be feeling afraid right now because these symptoms seem as though they could happen to anyone at any time. But do you realize that by understanding them today, you have already given yourself and your loved ones an extra layer of protection? A stroke is truly a silent thief, but it does not always win, because when you recognize the signs early, call emergency services in time, and maintain a healthy lifestyle, you absolutely can control and reduce the risk. The question is, will you let fear hold you back, or will you turn it into motivation to live healthy and happy with your children and grandchildren every day? Remember that aging does not mean illness. With the right knowledge and the right actions, you can still enjoy peaceful years, watch your grandchildren grow, and continue leaving precious memories for your family. Wouldn't you like each morning to begin as a day worth living, rather than a day filled with worry about your health? If you agree that today's knowledge is important, please help spread this message. Hit the like button, share this video with your friends, so that more older adults can also learn to recognize the signs of stroke early. And don't forget to subscribe so you can stay with us in the next videos, where you will always find more secrets for living healthy, living long, and living joyfully. So, now that you know how to recognize a stroke, would you like to discover which foods can silently protect your heart and brain every single day? Stay tuned for my next video.